Hey everyone, welcome to my channel. I'm so excited to meet you all. I'm Uche Juliet. Thank you for liking, sharing and commenting on my post. Today we'll be discussing on malaria. Malaria is one of the commonest diseases found in Africa. And malaria is a deadly disease. I don't know why people are not afraid of malaria like HIV or AIDS, but it's among the deadly diseases found in Africa. Malaria is gotten from an Italian phrase, mal-a-ria, meaning bad air. Malaria is caused as a result of plasmodium infection. Majorly, we have 4 types of plasmodium species. We have Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malaria. And the female Anopheles mosquito is responsible for transmitting malaria. Do you know why I smile? The female, okay? So the male mosquitoes are innocent. The female mosquito, sorry, I'm a female, I'm not a mosquito, I'm a human being. So the female Anopheles mosquitoes are responsible for transmitting malaria. So the female Anopheles mosquitoes are the vector, okay? So we have characteristics you see in an individual that will make you suspect that such an individual is suffering from malaria. Such features include headache. Whenever I see a person, how you see someone might say, I'm feeling headache, you just know that the person might be suffering from malaria. Sometimes it might come in form of chills and rigor. You could suspect that the person might be suffering from malaria. In some cases, the person might have body and joint pain. Sometimes in some cases you say, I didn't do any job today, I didn't do any heavy tasks today. Why am I feeling joint and body pain? So joint and body pain could be as a result of malaria. Because if a person is being infected by mosquito, most especially the female Anopheles mosquito, the female Anopheles mosquito, the symptoms usually show after 1 week to even 1 month after the person must have been bitten of the malaria. It's not in all cases that if a person is being bitten by malaria today, that the person will start feeling body pain and headache. In some cases, the malaria symptoms start surfacing after 1 week or thereabouts. Okay, so some of the features of malaria include chills, rigor, headache, joint or body pain, sweating. You notice the person is sweating a lot. Sometimes you notice the person doesn't have the urge to eat. That is loss of appetite. The person doesn't have, even if you bring out the person's favorite meal, at that time when the person is suffering from malaria, the person might reject the meal. Why? Because the person is having loss of appetite as a result of malaria. There are ways by which we can prevent malaria. To save yourself all the stress of joint pain, body pain, sweating, chills, vigor, headache, and some cases even vomiting. So it's not anyone you see vomiting, you see, this person is pregnant. It could be that the person is suffering from malaria. So there's good news. There are ways you can prevent malaria. One of the ways you can prevent malaria is by using mosquito repellents. Mosquito repellent could come in form of lotion. You apply it on your body when going to area you feel might have malaria. So when they perceive the smell, the mosquito is being repelled from coming close to you. You can also prevent mosquito bites, most especially the female Anopheles mosquito that is infected. You can prevent mosquito bites, you can prevent malaria by using mosquito tent. Some people feel like using mosquito tent is a cage, a mini white or blue cage. No, it goes beyond that. The benefits are numerous to mention. When you use mosquito tent, it prevents mosquito bites, the female one, because it's the female one that is causing all this mess. I'm so sorry. The female Anopheles mosquito is the one causing malaria if infected, okay? So when you use mosquito tent, you prevent mosquito bites. Okay, you prevent malaria. You can also prevent malaria by having and maintaining it good sanitation. You clear down the bushes in your area. You clear it down. By so doing, you curtail the spread of malaria. If having done this, or probably you didn't remember to do this on time, and you're already experiencing malaria, there is good news. It can be cured, okay? Some of the ways you can cure malaria is by taking drugs. But you have to seek the medical advice of a doctor before taking any of this. Because there are drugs that are allergic to some patients, okay? Good. Like chloroquine. Chloroquine is, I'm not allergic to chloroquine, but there are some patients, when they take chloroquine, they start feeling itching all over their body. So by the time they make it known to their doctor that they are allergic to chloroquine, the doctor will know the kind of drug to attach to it, because antihistamine drugs are being attached to drugs like chloroquine for those that are allergic to it, so that it will prevent itching of the body. So some of the drugs used in treating malaria are Poluta, Poludrine, Malozone, Quinine, Chloroquine, Amatem soft gel, and many other more. If there are any drugs I didn't mention that you know that can be used to treat malaria, you can drop it down on the comment section. So today we've learned a lot. We learned that malaria is one of the commonest endemic found in Africa, and it is gotten from an Italian phrase, malaria, meaning bad air. We also learned that malaria is gotten by Plasmodium infection, and we majorly have 4 types of Plasmodium infection. We have Plasmodium falciparum, Plasmodium malaria, Plasmodium ovale, Plasmodium vivax. We also said that the vector responsible for malaria is the female Anopheles mosquito. We talked about the features of malaria. We said that there are characteristics or attributes you see in a body that will make you know that such a person is suffering from malaria. And we said such characteristics include rigor, chills, sweating, headache, body and joint pain, sometimes loss of appetite, in rare cases, dizziness and vomiting. We also talk about the preventive measures of malaria. We said maintaining good environment, sanitizing the environment, clearing down the bushes. We also said another way of preventing malaria includes use of mosquito repellent. Another way of preventing mosquito is by using mosquito tents. Okay, we mentioned some drugs that can be used to treat malaria. There are many drugs, but we mentioned few. We mentioned Poluta, Poludrine, Malozone, Quinine, Chloroquine, Amatem soft gel, etc. If there anyone you know has been working for you, you can drop it on the comment section. But before anyone takes them, make sure you seek the medical advice of your doctor. Till we meet again, bye for now. Thank you for liking, sharing,